Hi, my name is Simeon Nilasha, and the trigger point of the week this week, we're going to explore the adductor muscles of the hip, the adductor group. So there are three adductor muscles: the adductor magnus, the adductor brevis, and the adductor longus. So let's start with the anatomy. The magnus, as the name would sound, is the big one. It's the big one. So the magnus takes its origin from the ischial tuberosity of the pubic bone of the ramus, and also the pubic bone and the ischial tuberosity, and it inserts down onto the medial part of the femur, the linea aspera. And in fact, all of the adductors sort of come from the pubis area and the ischial tuberosity, and they run down. So the longus comes down a little bit higher up, and the brevis again higher still. Now, in terms of pain maps, let's have a look at those together. So the adductor magnus pain map very much is a medial kind of knee, almost like Pezan-Sorini pain. And there's a reason for that, obviously, coming shortly. Definitely strong pain in the anterior medial thigh, and pain also around the infrapatellar region as well. So the magnus certainly connected to thigh and groin pain, medial thigh pain. Longus has a very similar kind of pattern, and the longus and the brevis tend to sort of mimic each other. But here you can see that there's a much longer radiation, much more in the medial knee, all the way down the shin, and also, interestingly, in this kind of lateral thigh, so almost like you would see in trochanteric bursitis or bursopathy. So certainly worth exploring the longus for that. Brevis is a very similar map, really, to the longus, actually similar in the literature. So the adductors, well, let's think about it. The adductors, thigh adduction, the adductors can get overloaded when you are abducting the hips. So any exercises, horse riding, things where you're forcibly adducting the hip or abducting against things. So we see it sometimes circus performers, people that are on tight ropes, people that do athletics, gym work, people that are really good at doing these hip muscles. A lot of people do a lot of hip work in the gym these days, trying to sort of firm up their buttocks and their thighs and their hips. So we can see it overloaded there. What's very interesting, though, is that certainly with the adductor magnus, is that we can sometimes see genital referred pain. So pain into the scrotum, pain into the testes, and also very much connected to gynecological problems. So the pelvic floor, if someone's coming in with pelvic floor pain, it's really worth looking for trigger points in the adductor group. In general, and the reason for this is kind of a little bit to do with the embryology, the way that the legs grow out of the pelvis and drag the skin with them. Whenever there's a gynecological myofascial problem, it's always worth looking at the adductors, or as I said, also for sort of urogenital pain within the man. So as a group, what we tend to find, the other thing is with osteoarthritis of the hip, and one of my colleagues, Stuart Hines, has covered this extensively with some of my work with the hip. We work together on this, is that we tend to find either adductor magnus, longus, or brevis, but usually if there's OA hip, we have someone lying on the ipsilateral, on the side of the OA hip, and we'll find an adductor trigger point usually in the longus actually, or the brevis, sometimes the magnus, which is very much connected to hip range of motion. So gynecological, urogenital, people that have sports where they're going to be gripping that hip together, or osteoarthritis of the hip. So for all of those, we would want to look at the adductor group, and the adductors are the trigger points of the week. I hope you enjoyed that. If you enjoyed that, please feel free to subscribe to our YouTube channel. We've got plenty more videos on trigger points, and we would love to have you on Facebook also as part of our community. Thanks for watching.